The coronary arteries are those blood vessels that feed the heart muscle. The heart is a big muscle. It's a pump. It's supposed to move blood. It takes blood from the lungs and moves it to the body. It takes blood from the body, puts it into the lung to get oxygen, and again starts the whole cycle all over again. It beats about once a second, 60 seconds a minute, and goes like that till essentially you expire. Hopefully 80, 90, or 100 years of age. It'll turn up or turn down, depend on stimulation of what you're doing as far as activity. Now the problem is those blood vessels that feed the heart are very important that they stay open. When you're young, usually blood vessels are wide open. Blood flow is like going through a clear pipe. You'll have blood flow right through. The amount of blood and the size of the blood vessel are just enough to feed that heart oxygen every second of every hour of every day of every year. The problem will sometimes come when my patients that get older, they don't involve themselves in exercise. They get a little bit heavy. They might smoke a little bit, they might drink a little bit too much, and they definitely don't follow a whole food plant-based diet with good fiber and or oil, omega-3 oil. And when that happens, as per the nurse's health study, then usually it'll cause those arteries to get lined with cholesterol. So then the artery suddenly looks like this. It's a little bit narrow compared to before. And it's not exactly blocked up 100%, but it is blocked up. So the flow is a little less. And if your artery that's trying to get blood to your heart muscle, it's beating every second, every hour, every day, every year, if it's asking for a little more, it might tell you, oh, I can't do that extra bit of lifting that you wanted me to do, or the extra 5 miles you wanted me to do, because I don't have enough blood flow. So it'll tell you, slow down a bit, and that's usually when you hit the wall. So I'll have people, it used to be when you're 60 or 70, people would get those signs, congestive heart failure or just exhaustion. Then they go to a cardiologist, and then they'd be told, well, you've got a little bit of a problem. Now you're getting that at 40 to 50 years of age, whether it's found by stress testing, like echocardiogram, that's called a stress echo, or nuclear stress test, or CT scan of the heart, best done in February when it's heart month and it's cheaper, or an angiogram. And if you're one of the unfortunate ones who has high risk and you get an angiogram, well, it might be good that you get it, but it's bad if you find narrowing. So I've had the experience of patients getting sent to cardiologists, being told you have a narrowing, being placed on a statin and some other medicines, and being told to follow up. Just maintain the statin, maintain the blood pressure, you're good to go. But I disagree 110%. And usually what happens is those patients that don't manifest a lifestyle change, and again, it's moderate to vigorous exercise, body mass index below 25. If you don't know what BMI is, then look at my video. No smoking, moderate. I just say forget the moderate, forget the alcohol. If you're fighting for your life, forget the alcohol. It's empty calories anyway. Or if you're not eating a low glycemic, whole food, plant-based diet with great omega-3 and high fiber, then guess what? You know what's going to happen? You'll be maintaining your cholesterol and your LDL low because you're on a statin. You might or might not have muscle pain. You might not have fatigue. You might have problems with poor sex. But the blood pressure will be manifested. Everything will be cool, but you're going to have more narrowing of the artery because you didn't do anything with those 5 measures of lifestyle. And you just took the medicine. So I disagree with some of my cardiologists. Everything gets narrower. If it gets narrower, guess what? As time goes on, if you only had 1 stent put in about 5 years you'll have 2 more stents put in. And the 1 stent that you had put in, if you didn't do anything with your lifestyle, it'll get narrower some other place before or after the stent. So the idea with stenting is that you kind of get something in there and you pop open. You get a balloon in and you pop open and you put a stent, a coil that keeps things open. And imagine if I just push this sponge so it's wide open, okay, that's fine. You're back to being open again, but the area in front of or behind the stent, that stays there, and it exudes or eludes a little bit of dilating medicine. The area before and after that will still stenose, or the other arteries will now continue to get narrower and narrower and narrower. It happens to all my patients. Usually if there's one vessel that you kind of find 5 years later, there's going to be other vessels. So you got to make, what's more crucial than using a statin and keeping your blood pressure low is really exercise and lifestyle change. I have to say that a patient of mine gave me this book. It's an excellent book. It kind of reiterates the same thing that Abramson brought out. I met Abramson at Harvard when I was learning from Herb Benson, and this is an excellent book. And it's an old one, but it also talks about the cholesterol myth. So it's not just lowering your cholesterol. I think that as a metric, it's nice to be able to lower your cholesterol. It's also nice to be able to lower your body mass index. It's also nice to be able to cut your calories down. It's also nice to be able to cut your tobacco out. Again, I've spoken about all that stuff already, but most and crucial is that if you've got anything, even if you had bypass, if you've never noticed or been witness to anybody in your family that has gone through bypass, it's excruciatingly painful to have somebody cut with a saw. You cut open your sternum, take and rip out blood vessels from your leg, put them in your chest, sew up all the cavities, and then have you lead a new life. I mean, it will give you a new, hopefully 10 years more, but you have to make the changes. And to the children and relatives of the person having the bypass, you got to learn just from what the suffering is that unfortunately you might be next to have that blood vessel narrowed. It's really important, even if you're healthy, it's still important to manifest as best you can, because heart disease doesn't happen just with fat people, overweight people smoker. Heart disease also happens to thin athletes too. That's why I always say, even if you're an athlete, even if you exercise, it's still important to have those parameters all met. Just think of Alberto Salazar or Jim Fick. These are marathoners that had massive heart attacks. So I'm not saying that everybody's going to have it, but if it's in the genes, then you have to be extra careful. You got to get to your doctor's office. You have to make sure all your parameters and your metrics are hit. And you have to be leading a healthy life is most important. If you don't have it in the genes, but you're living an unhealthy life, well, change the way that is. Because even if you make it past the heart attack and the narrowing of the coronary arteries, guess what comes next? Cancer. Cancer asks for improper, unhealthy life. And when you live an unhealthy life, it usually will speed up your chances for having that cancer show up. So if the cancer was supposed to show up, or a heart attack was supposed to show up at 80 or 90, you're going to bring it much closer. The mountain will be pulled closer to you at 50. So you really want to avoid that, because I guarantee you that with modern technology and medical insurance the way it is, if you're having a heart attack or if you're having a pre-cancer, we're going to make you live. Whether you like it or not, you're going to live, just because that's the obligation of your doctors and the emergency room is to give you a couple things or procedures to make you live. And then what? Then you live on disability, not able to do anything, on a whole bunch of medicines, and just unhappy. So why wait until then? Try to get in before that happens, before the narrowing occurs. And even if there is narrowing, you can still reverse it. Dean Ornish was one of the first doctors to pioneer, or at least find that instead of thinking that once you have stenosis, you're done and stenosed for life, he was able to find that with a low-fat, mostly plant-based diet, group therapy, exercise, yoga, he found that you can actually reverse disease in coronary arteries, and that started the whole process of trying to lead a healthier life. So Dean Ornish's website I'll put as a link here. The Great Cholesterol Myth, excellent book if you want to kind of get the conspiracy theory, but in fact, so it's not necessarily a conspiracy. Or Abramson's book on how we, not only with cholesterol, but also with hormone replacement therapy and a couple other things. Excellent book. This is an older one, but it just is reiterated in the newer books. So the bottom line is that you really have to lead a healthy life. And if you think that you're not having any symptoms, and yet your family is showing signs of disease, you gotta be careful, because sooner or later you're gonna have to pay and the symptoms will come. And if you wait until you're debilitated, deconditioned, and overweight, it'll be even twice to 3 times as hard to initiate that lifestyle change. So it's much better to try to get proactive.